my name is Katrina Dunn, and today I'm going to do my assessment video. This is my patient here. Would you mind if we film this for my class?
Not at all.
Thank you. What is your name and your birth date?
Brittany McCain, 1988.
Okay, so the first thing we do is we assess the skin. So we want to make sure that her skin is warm, pink, and dry, which it is. And then you assess the turgor right at the sternum to make sure it's not too tinted and it's a good quality. Then I'm going to check the edema at the lower legs, which I would normally do with her shoes off and pants off, but I'm going to do through it right now because I can still kind of see it. And it looks like she's got about +1 edema. Do you have any current wounds right now?
I do not.
Good. And I'm going to go ahead and have you stand up so we can check your gait and your balance. Can you put your arms out to your sides and then right in front of you and then palms up? Good. And then I'm going to have you walk in a circle. Okay, with that decent balance. And then go ahead and grasp my 2 fingers. Okay. And try pulling down just a slight bit. There we go. Okay, go ahead and sit down, and I'm going to check your feet. Yes. So go ahead and push on this foot and the next foot. Okay, so with that all, we're testing her, at first her balance to make sure she can have her arms out and not be wobbly. We were also checking her gait to see how she can move without the use of different devices like walkers, canes, and whether or not we'd need anything to help her with her recovery. Another thing we always check for, especially when you're assessing skin, is you're looking at the Braden scale, so you can decide if they're going to need any pressure mattresses or any type of heel protectors. That way they don't get any types of bed sores while they're here in the hospital. And SCDs, I would probably still put on most of my patients with the doctor order so that they don't get any DVTs while they're in the hospital. The next thing we're going to do is we're going to do an assessment of the abdomen. Okay. I don't want to expose my classmate's stomach in front of a camera, so I'm just going to do this through a shirt, but normally I would not do that. The first thing I would do is assess, and she doesn't have any obvious wounds. So I would then auscultate her bowel sounds. And you always start in the right lower quadrant so that you're going in the way that, the bowels move. And you're listening to make sure that you hear bowel sounds, and you only have to listen for a few seconds each time just to make sure that you're hearing them and they're not hypoactive or hyperactive. If you didn't hear any bowel sounds at all, you would wait for 5 minutes per quadrant to do them. Next thing I would do is I would palpate the patient's abdomen, still starting in the right lower quadrant, and I would do this with only one hand and only go 1 centimeter deep. And you kind of do it in just a very clockwise motion. You're just checking for any masses or anything like that. This patient has a BMI of 25, and at 5'6", 155 pounds, she is 119% over ideal body weight. Can you tell me a little bit about your diet? What do you normally eat?
Delicious stuff.
Delicious stuff? Okay. And there's no scars, no obvious bruises, and no masses. So that is decent. Okay, before I forget, when was your last bowel movement? Today?
Is she
okay,
FOS?
How frequently do you have bowel movements?
Once a day.
Okay, and what was the consistency of your last bowel movement?
So formed and round.
Okay, thank you. You can go ahead and sit up. And I have you sit up. I'll ask about your genital urinary system. Okay, how often do you urinate per day?
3 or 4 times.
3 or 4 times a day? Do you have any hesitancy when you urinate?
Nope.
Okay. Any dysuria, any trouble urinating?
No.
Okay. And do you get up in the middle of the night to use the restroom?
No, I don't.
Okay. Any different unusual discharges right now that you aren't sure of?
Nope.
Okay. We do have a sample of her urine, and the color is a little bit brighter yellow, so she probably needs to drink a little bit more water. But the consistency is nice and thin. There's no obvious sediment in it, and The odor is just like any normal urine would be. Thank you very much.